Welcome everybody to our session looking at how we can drive co-benefits for climate and health through private sector action. My name is Sally Uren. I'm the CEO of Forum for the Future, and it's my great pleasure to be here today to really introduce our new guidance that is available on our website today and to bring it to life. So what we are wanting to do today is to shine a light on the action that the private sector can take in terms of developing integrated strategies that drive co-benefits for climate and for health. The session is drawing heavily of a new report that we're publishing today, which in turn has been supported by GlaxoSmithKline, by Bupa, by Walgreen Boots Alliance. And those are also the organisations that are here today to join me as panellists. So in order to bring the guidance to light, I'd love to welcome our panellists. We have Dr. Paula Franklin, the Chief Medical Officer from Bupa. We have Dr. Terry Ling, SVP, Head of Transformation and Sustainability at GlaxoSmithKline. And we have Richard Ellis, who is the VP Corporate Social Responsibility at Walgreen Boots Alliance. We're also going to hear from Jane Burston, who is the CEO of the Clean Air Fund. More of that in a moment. And we've got about 40 minutes to bring this report to life. And then there'll be an opportunity for questions and answers at the end. So please, if you have any questions as we're discussing the report, sharing the findings, please do pop those in the chat and we'll come to those at the end, where we'll also be joined by Jane. So, private sector guidance for driving co-benefits for climate and health. I'm going to start with Richard, if I may, in terms of shining a light on the background to this project, because the project really builds on a report that we both contributed to with the United Nations Global Compact, Healthy Leadership, Healthy Planet. And Richard, can you just tell us why you've been keen to see this work go forward?
Thank you, Sally. At Walgreen Boots Alliance, we have seen the impact that climate change has had on the health and well-being of the people who live on this planet. It's highlighted in the United Nations Sustainable Development Goals, where health is a major issue. So it was only natural that as a health and beauty company, we should become involved in this United Nations Global Compact strategy. It was launched on the 19th of September 2019, and the leader of Walgreens was the keynote speaker. This paper created much discussion, and we at WBA were asked to continue to investigate what the private sector might be able to do and how there might be more collaboration between all those interested in health and its related topics. We organised a series of roundtables. Each of these was focused on a different health topic and was held in a different part of the world. And we asked Sally and Forum for the Future as an impartial organisation to capture these various outputs and build them into the document that's being launched today. As we were developing our thinking, we were joined in this collaboration by GSK and Bupa. And the contribution of each of these three partners has been critical in getting us to this stage. The report highlights that if organisations come together to tackle climate change and work together, they can achieve far more than working on their own.
Thank you, Richard. So I'd just like to give a bit of background from Forum's perspective, if I may, and really highlight why as Forum we've been so interested in this conversation. And really there are a couple of reasons. The first is that both climate change and public health are systemic challenges. They are multifaceted, they're multi-causal, and action on one has the ability to impact the other. By looking at the connections between climate and health, we can start to understand how to drive systems change. How can we reconfigure our climate and our health systems so that they work for the good of society, help restore our ecosystems? And then there's a third reason why we think this report is so important. What we've tried to do in the report is to highlight how every action that the private sector can take on net zero can also drive benefits for health. So in other words, how can we make everything that the private sector does in the race to net zero drive maximum benefit for health, but also for nature and for biodiversity? So by looking at health and climate in an integrated lens, we're really hoping to see accelerated progress and action on both of these critical issues. So what I'd like to do now is to bring those connections between climate and health to life. And I'm going to ask each of the panelists, if I may, just to share one topic that they feel really is a good illustration of how these issues come to life. And I'm going to turn to you first, Terry, if I may. And I believe you're going to shine a light on the connections through the lens of air quality.
Yes, thanks, Sally. So, at GSK Consumer Health, we're really working to break down and tackle the barriers to people's better everyday health. And it's clear that climate change has and will and is right now affecting more and more people's health in really a myriad of ways. But air pollution is an area where we see it's affecting people right now, and it's affecting a lot of people right now. And therefore, it's very high on our agenda, because we know that poor air quality is affecting the majority of people on our planet today, and it affects their health in many different ways. So we feel that addressing air pollution is really something that is timely, that is necessary, and that takes a lot of players to work on. And there's really two fronts. We need to address ongoing climate change, because that is making our air quality worse and worse. And obviously, if we can work on improving air quality, it will be beneficial towards slowing climate change. But the second thing is that we have to help people live in this world today. We have to give them the ability to understand how air pollution is affecting their health, and be giving them ways in which they can mitigate those effects on their health.
Thank you, Terry. I'm going to turn to Paula now, if I may. And how would you, Paula, build on the links between climate and health through the lens of air quality? What's the Bupa's perspective on these connections?
Well, thanks, Sally. I think that we are clear now with an overview of the research that air pollution levels have been linked to mental health disorders. And we know that long-term exposure to even small particles of pollution in the air is associated with depression and anxiety. And sometimes even short-term exposure to common air pollutants has been associated with increased suicide risk. So we're talking about real issues and real challenge to people. While the evidence of a direct cause from one to the other isn't yet there is emerging evidence to support the conclusion that actually there's no safe level of air pollution when it comes to your mental health. It's not just monitoring and managing. Actually, it's better not to have any at all. The other thing that's associated, though, with climate is that it's not just the air quality that can impact your mental health. It can be directly impacted by climate disasters, for example, and the consequences of climate change. And there is a sort of overarching mental health aspect that's emerging now amongst people that are concerned about climate change. And there are two new terms that have been coined: ecological anxiety and ecological grief. And these are, as I said, new terms, but very real for the people who are suffering them, and particularly noticeable at the moment in young people who are understanding and seeing the impact of climate change and feeling hopeless, quite frankly, about the possibilities for the future. It's also a very real thing for people who work on the land and whose livelihood relies on the land and the intact environment. So really tangible impacts on people's health and very much affecting people's mental health.
Thank you very much for that. And thank you for bringing in that lens of mental health and just underscoring how when we look at air pollution, it really helps us understand these connection points between climate and health. And thank you also for building out the broader links between climate and health, particularly in respect to mental health and well-being. So air quality, air pollution is one of the lenses that we use in the report to bring these intersections between climate and health to life. The other issue lens that we use to try and bring these connections to life is malaria. And I'd like to ask Richard just to tell us a bit more about how, by looking at malaria, again, do we see the intersections between climate and between health?
At the turn of the millennium, we thought that malaria, an entirely preventable disease, was being tamed. Death rates were falling, and all of the resources that were being used to help people seemed to be making a real difference. But then progress stalled because of climate change. And it's meant that the mosquito can thrive in countries where it previously could not survive. And 409,000 people, mainly children, actually died of malaria. So that's one child dying every 2 minutes. Climate change means we are effectively having to start the campaign against malaria again. So thank goodness for charities like Malaria No More.
A really stark link there between climate change impacts, increased incidence of malaria, and certainly in the discussions that we had as we were gathering insights for the report, we were really surprised by actually how little awareness there was of the links between malaria and climate, particularly as it applies to private sector global supply chains. Many global supply chains are in areas that are going to see climate impacts and increased incidence of malaria. We then explored a third area to try and kind of bring these connections to life, and that was food. Climate change will impact food security. It will also affect our access to healthy food. And again, as with air quality, as with malaria, there are opportunities to build resilience in the food system and also to provide positive impacts for climate and health. So if we reduce the need for nitrogen fertilizers, for example, that reduces greenhouse gas emissions. It also reduces the risk of pollution of watercourses. If we can restore soil health, we improve the ability of soil to capture carbon, but also to drive nutritional quality of crops. And clearly shifting diets to more plant-based proteins has good implications for health, but also implications for bringing down carbon emissions. So food was the third lens that you really used to bring these interconnections to life. So having made the connections between climate and health very real in the report, we then wanted to move on. So actually, as the private sector, what can we do? What are the practical strategies that we can develop to really focus on these intersections and to develop strategies that drive climate and health benefits? And just before I ask each of the panelists to bring that guidance to life, just a bit about the framing that we used. We really tried to make this very practical. So within the report, we have guidance for all businesses in any sector, starting with their direct operations. Reducing greenhouse gas emissions clearly has a positive climate impact. In terms of air quality, a positive health impact. We then look at what you can do in terms of product service innovation, what is available in terms of employee engagement and well-being. Then looking at how you might manage your supply chain for health resiliency and for climate adaptation and mitigation. And then we also come up with suggestions for how businesses can influence that wider enabling environment through partnerships, through advocacy. And all of these are nested. Every business has the opportunity to drive action in each of those areas. So what I'd love to do now is to bring that guidance to life. And I'm going to go to Terry first, just to share some of the examples that we've covered in the report and some of the work that you're doing at GSK to design strategies that drive benefits for climate and for health.
There's many ways that companies can lean into this. It's through many of the stakeholders that we're involved with. We can bring more understanding and information, bring services, bring new innovative products that help people mitigate these issues. So from our perspective, we're really focusing on all of these. We've partnered to bring to life a foundation, the Clean Breathing Institute, which we're hoping will help drive more research and development and more scientific investigation in this space and really highlight to policymakers and governments what is really going on in terms of the effect of air pollution and climate change on people's health. So that's one area in which we want to lean in and really stimulate the knowledge and understanding. And we do believe that the more you stimulate that awareness, the more we drive people into actual action and beginning to see those benefits happening. Other things we've done, our Otriven brand has been working to bring to pharmacists and healthcare providers more information about the local impacts of air pollution in their communities and how they can advise people that they work with day to day. So it's really important that we help the people that give people advice in this space to have the right information. And the Ocean Brain is also working with people directly to provide some services, some tools that might help people identify where in their daily life they might be exposing themselves to quality air and what they might be able to do to minimize their exposure to air pollution throughout their day. So ways to help people cope with the situation and services. And then we've done some, I would say, experimental work. We've created a clean air bubble in one of the most polluted areas of Warsaw on a children's playground, just to demonstrate and to inspire people to think about what clean air could mean for these children as they're growing up. So I think there's many ways for companies and products to get engaged in this and to really bring both solutions, but also just raise awareness and impetus for action.
Thank you very much, Terry. And I should say in the report, we not only set out guidance for all businesses, but we've shone a spotlight on healthcare industry. So thank you for bringing that to life in that way, Terry. I'm going to go to Paula now to hear again more examples of what actually private sector action could look like when it comes to these co-benefits.
Thank you, Sally. This is really a central part of our strategy now at Bupa. As a global funder and provider of care, we're very conscious not only that our health, that human health, relies on us having a healthy planet, but we're also very conscious of the fact that delivering healthcare has a significant negative environmental impact. And so there's a requirement for us to balance both those things. Healthcare's climate footprint is equivalent to 4.4% of global net emissions. And apparently by research by Healthcare Without Harm shows that if the global healthcare sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. So healthcare is certainly responsible for a lot of negative impacts. And we see this through the provision that we have, and we look at things like the use of anesthetic gases, for example, which has a significant impact on the environment. So we think we have a clear role on both sides of this, both a healthy planet for healthy people, but also doing our best to minimize the impact of provision of healthcare on the environment. We've committed to science-based targets, and we'll be announcing our targets across the 3 emission scopes later this year. But that, of course, is only the beginning. That's only the start of it. It's very important that we build climate action into all of our business plans and our business programs, that we make it central to our strategy, not just the action, but also the reporting, and so that we can progress our climate agenda. One of the key things that we find for this is digitization of healthcare. We will have all seen through experiencing the pandemic that the use of digital healthcare and virtual healthcare has expanded exponentially. And this is now a really effective way of delivering care and also helping manage emissions and environmental impact. So limiting the amount of travel that people have to undertake, but also limiting the impact of buildings and equipment and so on that are no longer necessary or no longer used in that way if people are accessing care in a different way. An example of this is in our Spanish business, Sanitas, where we have built a digital customer journey and a zero emissions video consultation. And what this means is that when our patients in Spain access care through this app, and when they use the app to do things like download prescriptions, see a doctor and so on, at the end of that, they get a message that tells them how much CO2 emissions have been avoided by them using the virtual healthcare delivery rather than actually accessing care in the traditional way. The interesting thing about this is not only is it good for patients and customers, they enjoy receiving healthcare in this way, it's more convenient for them and easy, but they actually really like the idea that we are mindful and conscious about the environment and about the impact on it. Another thing that we're doing is with our people. We found that it's really essential to engage our people in our strategy on this, and people are feeling very enthusiastic. And so we launched a program earlier in the year we call Eco Disruptive. It's a combination of a talent program, so it's our brightest minds, and they've been selected from across the Bupa Group to work with eco and climate change startups. So this has been a really interesting journey for us, looking at new startups and what they're doing and how we might be able to support them. And so we're at the moment incubating 18 of these startups, and it's engaging all of our people, led by, say, this sort of particular talent group. And it's proving to be very, very, very good for our people, good for our work on sustainability. The final thing I want to mention is our work on what we're calling healthy cities. We have a healthy cities project in Spain. And in this, we challenge our people to work in an environmentally friendly way. So in other words, to walk, to leave their car at home, to manage how they live their lives in a more environmentally responsible way. And it's all these ideas are all aligned with the WHO recommendations. And whatever challenge they set themselves, when they've completed it, then they unlock a donation. And so they can see that the impact of the changes they're making is not only their own personal environmental impact, but an added contribution. And it seems to be going very well.
Thank you so much, Paula. And in the report, there are a lot more examples of how to engage employees in ways that really are motivational, but also are driving these health and positive climate impacts. So thank you for sharing that with us. So I'm going to go now to Richard, if I may, and ask the same question. Richard, would you mind sharing some of the activities that you think are really important for organisations to adopt and drive ahead in driving these co-benefits?
Well, for over 20 years now, Boots, Alliance Boots, and now Walgreen Boots Alliance has sought to tackle climate change and promote sustainability. And it's done all of the things that you might expect a company to do. LED lighting, more efficient equipment, buying better fridges, and training our people, our team members, so that they understand more about energy management and energy efficiency, both at home and at work. And yes, this did make a difference, and we achieved a 30% reduction in our carbon emissions over a period of 10 years and met our May Day commitment in the UK. But were we really making an impact? Were we really making a difference? So we started to look at our operations and how we might make them more efficient and more sustainable, and in particular how we might work with our suppliers and our other stakeholders. So we began sharing deliveries with other retailers, sharing our waste and recycling data with the NHS, working on ways of removing plastic from packaging with our suppliers, creating benches out of recycled red noses with a charity, really looking at how everything could be related to a circular economy. And all of these things helped us to become more resilient, adapt better to changing circumstances. But what the finance department like is becoming commercially more successful. We were saving money. This has really shown us that by collaborating with the likes of GSK and Bupa, we can achieve so much more than if we act upon our own. Now, perhaps we haven't told this story particularly well. And that's really why we're here today, why we've worked with these partners to be more transparent and to shed a light on what can be achieved if you work collaboratively with others.
Thank you, Richard. And that point about collaboration, about partnerships, is covered also in the report in terms of how individual organisations can create that broader enabling context for the change that we need to see. And it's on that theme that we really also wanted to use this session today to just talk about what we might need from government. So private sector action is really important. Everything you've heard that GSK, Walgreen Boots Alliance and Bupa are doing, super important. We need many more businesses to take that kind of approach. But the private sector will not be able to drive the systemic change needed in climate and health on its own. There is an absolutely critical role for government. And to really understand what we need from government, again through the lens in particular of air quality, we asked for some thoughts from Jane Burston, who is the CEO of the Clean Air Fund. And Jane is going to share with us some recommendations that the Clean Air Fund would like to suggest to government for them to play their role in driving this systemic change.
So the Clean Air Fund is a philanthropic initiative to create a future where everybody breathes clean air. We're a young organisation. We launched in 2019 with an initial 50 million in donations. And in our first 2 years, we've funded more than 50 organisations, many of them grassroots charities making a difference in their communities. One of the Clean Air Fund's aims is to get more businesses working on air quality. And there are 5 reasons that we think businesses should get involved. Number one, as we've heard from the panel, reducing air pollution can deliver both health and climate gains. And unlike climate change, air pollution is an issue that's localised, it's immediate, it tangibly affects people and their communities every day. So for some people, it can be easier to engage with. Secondly, if done right, working on air pollution can also promote equity. We know that all over the world, it's the lowest income and most marginalised groups that are most exposed. For example, people of colour in the United States are disproportionately exposed to high levels of particulate pollution. So you could tackle health and climate change and equity all at the same time by reducing air pollution. Third, whilst we know that the lowest income groups are most exposed, it's also true that air pollution affects almost everyone. So it's likely that your employees and customers care about this wherever they are in the world. We know from the World Health Organization that 9 out of 10 people breathe air that's harmful to their health. So from the US to Germany, from India to China, clean air is increasingly recognized as a priority. And it really affects your business. Pollution can do huge damage to your business. Fourth, air pollution is deterring talent from cities. Cities with severe air pollution are seen as less desirable places to work, and it negatively impacts on the recruitment of top talent. And fifth, it reduces productivity. A new wave of studies reports that air pollution can hinder our cognitive abilities. And the Clean Air Fund's own research with the Confederation of British Industry found that the UK could benefit by more than £1.6 billion annually if it met the WHO guidelines for air pollution. An important part of our work, therefore, is building coalitions with leading businesses that want to join with others to have an impact in this area. And we're starting to see real momentum. At the same time, government has a critical role in making sure that the air that we breathe is healthy and not harmful. Governments worldwide are setting and tightening standards. More than 1/2 of countries have established national ambient air quality standards. And governments are beginning to see that people want this. At least 70% of people are concerned about air pollution as a public health and an environmental issue. And in some countries, that number is significantly higher. We would like to see governments, locally, nationally, and globally, encouraging and incentivizing businesses and individuals to swap polluting practices for clean ones. And businesses have a very powerful voice that governments will listen to. They're often ahead of government with greater ambition and a faster pace of change, which is why business advocacy for clean air is so important. So for businesses who've joined the call, please get involved. And there are 3 top ways that we think you can do that. Take action to measure and reduce your own air pollution footprint. Join the Clean Air Fund and others that advocate for clean air policies and regulation. So in the UK, for example, that might mean advocating for more electric vehicle charging points or for clean air zones. And innovate. Use your company's assets to find new ways to tackle air pollution and to further the cause. Please do get in touch if you want to find out more about how the Clean Air Fund works with businesses on this agenda, and I'm really looking forward to hearing your questions. Thank you.
Great thoughts there from Jane, and Jane will be joining us for the live Q&A in a moment. So if you haven't been posting questions in the chat, just a reminder to post some questions in the chat box, please. But I'd like to now, as we wrap up this part of the session, to continue with the theme of what else do we need to see from other actors, be they investors or policymakers, recognizing that broader enabling environment that will enable this shift to healthy people, healthy planet will require all different actors working in different ways and collaborating. And so I'd now like to turn to each of you and ask you for what you would like to see from these broader set of actors to complement what you're doing in your own businesses. And I'm going to turn to Paula first, if I may.
Thanks, Sally. I think one of the things that is very much top of mind for us at Bupa is urban planning and the environment in which we live, how we move around, where we move, what we're exposed to, how far we have to go. And so we'd be very keen for policymakers to take this into account when they're planning, not just cycle lanes, but green spaces and easy access. The concept, for example, of the 15-minute city or neighbourhood, where you can reach everything that you really need quite easily from your home with a short bike ride or walk without having to use any kind of motorized transport. The other thing is the opportunity, of course, to spend time in green spaces. And there's abundant evidence of the impact of being in nature on both mental and physical health and well-being. And the final thing really is around transport regulations. It would be wonderful, for example, to see clean air zones around areas where there are vulnerable people, so hospitals, schools and care homes. So these at least can be environments where people can move more freely and more safely.
Thank you very much. Some very clear recommendations there for policy changes and policy frameworks. Terry, the same question to you. What would you like to see from other actors to really support private sector action in this area?
Yeah, thanks. I mean, I think, Richard made the point that doing things that are good for the planet and good for people's health is also good for business. And I think I just want to reiterate this notion of following the money. Investors are more and more interested in what companies are doing to improve their society, both environmentally and socially. And I really think that these ability to direct money to capital investments or to investing in companies that have these multiplicative effects on our improving environment. Investing in a nature positive building project where you get a air pollution benefit, you get a reduction in carbon emission, but you also get a very positive human environmental event. So to me, it's that follow the money to these multiplicative effects where this investment can really give a myriad of benefits to society.
Great. Yeah, a really important point there around, every dollar that's invested, how do we invest that dollar that drives maximum benefit for climate and for health and for nature? And I think if we had that frame of mind, we might see more positive benefits really flowing through from investments that we're making today. So Richard, your turn now. What else do you want to see happen to support private sector action in this space?
Well, I think what would be key is the government supporting those businesses that are doing the right things, trying to create a level playing field, trying to implement legislation that supports those businesses that have taken the right choices. I think the idea that you can't bid for a government contract unless you have a science-based or net zero target is something that I'm personally very supportive of, because it encourages businesses to take the right decisions and to make the right choices and to be doing the right things.
Absolutely. certainly in the report as well. If you haven't noticed, we're talking about a new report here today. Go to our website, please download it, www.forumforthefuture.org. We have a whole section where we are really trying to provide guidance for public policy advocacy from business to government. So really providing some practical messages for the private sector to convey to government, and using that massive lever of public sector procurement is really full of possibility, a huge lever that government can use to drive action in both climate and in health. So with an eye on the time, we have 4 or 5 minutes left for this part of our dialogue before we switch to a thrilling live Q&A. I just have one more question for each of you, if I may. And that really is, since getting involved in this project, which in Richard's case has been since early 2019, for GSK and Bupa more recently, how has your approach to climate and health shifted, and how is your organisation stepping up to this twin challenge of solving for climate, solving for public health? And I'm going to go to Richard first, please, if I may.
I think the first thing is that it's not all about money. The key is working together, is sharing best practice. Coaching and knowledge sharing can often be more invaluable than an investment. And the key is building long-term sustainable relationships with your stakeholders, like we're doing with GSK and with Bupa. Our relationships now go much broader and much deeper as a result of this work. And I think that, after all, nobody can do business on a dead planet, so it makes sense for us to collaborate and work together to find solutions to these problems.
Great, yeah, and that definitely has been such a theme over the last 18 months as we've been running these dialogues in different geographies, albeit all on Zoom, because of course none of us have been anywhere, but we have heard from voices across the US and from Europe. I'm going to turn to Terry now. Since getting involved in this untangling of how we solve for climate and health, what difference has that made so far to GSK Consumer Healthcare?
Well, I think as we've been focused on tackling these environmental and social barriers to better everyday health, I mean, absolutely what Richard said, this is about big collaborative systemic change in order to make that happen. But we also find that even in the microcosm of our own company, everything we do connects to that purpose. Every brand, every manufacturing site, every procurement officer can have an impact on this goal. And I think it really, over the recent time, just really understanding just how this is not some separate thing we do in order to be a responsible business. This is the core of our business. This is how we deliver on the purpose of our business. And really everyone in the company is involved in this effort.
Great, thank you. And finally, Paula, I think Bupa is probably one of the more recent additions to this collaboration that we've been driving ahead. What difference has it made to Bupa?
Yes, we are a newcomer, but very, very pleased to be part of the collaboration. I think that for a while now, we have been very clear about the fact that we can't have healthy people without a healthy planet. But also a greater understanding of the complexity and interrelatedness of the issues associated with this. And so being part of the collaboration is just hugely helpful for us. It gives us the opportunity to work and exchange ideas with like-minded organizations, which is actually accelerating our learning and our thinking and helping us to define bigger and bolder goals and ambitions, but also really understanding and sharing, and as I say, learning and growing with others in the collaboration. And we're very happy to be part of it and really looking forward to working together.
Great, thank you. So there you have it, a tour of the content of the report published today, really trying to shine a light on the connections between climate and health through the lens of air quality, malaria, and the food system. Really trying to give practical guidance to the private sector to develop integrated strategies, to think about climate and health as a set of interconnected issues that offer huge potential for transformative change and could give us acceleration towards those end goals of healthy people, healthy planet. So I'd just like to say thank you to Richard, thank you to Terry, thank you to Paula, thank you for sharing your insights and your guidance today. We will be moving in a moment into a live Q&A where we hope to continue to bring the guidance to life. But I would urge you all to take a look and please give us feedback. This has been a few months in the making, but we really hope Forum for the Future with Walgreen Boots Alliance, GSK and Bupa, that the guidance documents is a real contribution to accelerated progress on climate and health and really convinces everybody there's such opportunity to be had by looking at these issues together, not separately. Because I think, as many of us have remarked through this conversation, we can't have healthy people on an unhealthy planet. The two have to go together. And the sooner we develop integrated strategies, the better we will be and the more progress we will see. So thank you all very much. And we're now going to transition into the live Q&A. Welcome, everybody. I'm delighted to invite our panelists back to take our live Q&A. And we've got some questions from the audience, which is great to see. So I'm going to kick us off with those questions. And the first responds to the fact that there have been a couple of recent reports from medical journals highlighting that climate change could be the leading health issue of our times. And I'd like to pose a question first to Richard and to Jane, which is, how do you suppose the publication of these reports will impact how we address climate change? Richard.
Thank you, Sally. There have been over 220 medical journals have carried the same article about the impact of climate change on health. And I think this is hugely significant because never before have the medical journals had such uniformity of agreement. And I think it shows that the medical profession really does understand the impact that climate change is having upon health. And it's not just the anaesthetists, it's not the phlebotomists or the GPs, it's the whole of the medical profession. And what they have done by sending out those letters is to let the people at COP know this is an issue that should be tackled now, today.
Great. So really adding some urgency to this whole interconnected space. Jane, anything to add?
Yeah, just that people also see this health impact of climate change as well, especially with regards to air quality. The Clean Air Fund did a survey with YouGov in quite a few different countries just at the beginning of the pandemic about how far people were concerned about air pollution. And what we were really surprised by is that people were very concerned about it as an environmental issue, but they were also very concerned about it as a health issue. It came second or third, understandably, underneath their infectious disease, because we did the survey at the beginning of the pandemic, but second or third in their list of health concerns. And I think that what that means about how we tackle climate change is that by talking about the health effects climate change, it's something that really engages people. We know that people are very concerned about climate change, but it's hard for them to integrate that concern into their day-to-day decision making. Whereas when they're thinking about the effects of pollution on health, for example, it's a lot easier for them to prioritize avoiding pollution day to day.
Great, and that's certainly a theme that we heard through the roundtables that fed into the publication of the report today, which is actually health is often the human face of climate change and can make it much more personal and therefore inspire people to take more action. Thank you both very much for that. I'm going to turn to you, Terry, now, if I may, and I hope through our dialogue and through the report, we've made a strong case for developing integrated strategies for climate and for health. But what would your recommendations be for how to get started on this integrated strategy pursuit? What were your first steps at GSK Consumer Healthcare?
Thanks, Sally. I think the first is to understand what your part in the system is, what's your purpose in it. At GSK Consumer Health, our purpose is to deliver better everyday health for people. And what we came to realize is you can't have healthy people without a healthy planet. And therefore, we really need to make core to our purpose, this tackling these environmental and social barriers to everyday health that people face. So first it was about establishing our purpose in the space and knowing what we can do. And then it became about awareness building, building things like the Clean Breathing Institute, where we're trying to get information out about the here and now effects of air pollution on people's health, working with pharmacists, with Walgreen Boots Alliance to give them the tools and tips to discuss this with people they come in contact with. And then finally for the consumers themselves, to begin to develop services and tools that can help them take charge of their exposure, maybe products that will help them mitigate the effects. But the journey is really from understanding how we can be a part of it and how core it is to being a healthcare company, to have to care about the environment, and then to bring it into the awareness and then the solutions phase.
Great, thank you. You mentioned Walgreen Boots Alliance. That leads me nicely to Richard. As a retailer, so not necessarily front and centre healthcare organisation, what were your first steps to begin developing integrated strategies that tied together climate and health?
I think the pharmacist is someone who is very much in the front line. The pharmacist is there seeing customers even today throughout the pandemic. And so what we got to do was to make sure that the pharmacists could start to understand some of the issues related to poor air quality and what that might do to health and breathing. And so gradually we've been able to educate them so that they become more knowledgeable, more understanding of the sorts of things that climate change can do to the health and well-being of people, and that they can give advice and guidance.
Yeah, I think that's just such a lovely example. So utilising the people that you have in your stores that can really make that difference face to face with your customers. Paula, I'd like to come to you, please, and to pick up a perception that certainly we've heard in our conversations as we were preparing this report, which is that tackling two big challenges at the same time, so climate, public health, might double the effort needed. And how did you deal with that perception, if indeed it was a real one in Bupa? We're having to now do climate on top of health or vice versa. And what's your advice for organisations that might be worried that this is just another thing to do?
Thank you, Sally. Actually, within Bupa, it was incredibly well received because it was very clear to our people. What we've heard about the relationship between health and climate, the opinion of the medical profession, our clinicians on the front line immediately understood this interrelationship. And so it made complete sense for us at Bupa to have climate as a priority alongside all of our other priorities related to improving health. I think we realised that the impact of climate on health, but also the impact of healthcare on the climate, and therefore the opportunity to address both sides of this, to maximise the efficiency with which healthcare is delivered, and also then address climate issues to reduce the need for healthcare. So to me, I think they go intimately together, and I think it's a very logical and hopefully easy argument for people to make and to understand.
Yes, and I guess in a sort of, well, we're still in COVID world, but as we move through this pandemic, one of the positives as COVID it really has highlighted the link between planetary health and human health, and has, I think, helped to see that actually any really great net zero strategy has to take into account public health. They're one and the same. You can't separate these two out. Okay, turning to a question that came through on the chat then. And this is the often vexed subject of advocacy and public policy lobbying. I'd like to ask Richard, as one of a big brand in this space, how do you, as Walgreen Boots Alliance, ensure that your lobbying power, so that public policy advocacy, is supporting climate policy and the required infrastructure changes, and isn't just, as what has happened in the past traditionally, just been about supporting the bottom line?
The answer to that is authenticity. You can't just have conversations when it suits you. You have to build relationships with people like the National Health Service.
Last year, we had a day where our waste and recycling people sat down with the NHS's waste and recycling people, and we sought to see if there were things that we could do to be helpful and beneficial. Now, when you're doing things like that, it helps then to have broader discussions because people know that you're genuinely interested. At Boots, for 20 years, we've reduced our carbon footprint year on year. We met something called the May Day commitment. All of those things show people that there is a genuine interest, and there has been a genuine interest for more than 20 years in this whole subject. And that's why we should be trusted, and that's why we should be included within dialogues.
Yeah, and in the report, which I hope everyone on this call has rapidly moved to our website and downloaded it, we have a whole section on what we're recommending as private sector messages to government, because private sector has got such a powerful voice and it's really needed to help shape the enabling policies for the transition that we need to see. Sticking again with a question that came through on the chat, thank you. Can you talk, Jane, I think this is one for you, about the economic benefits of dealing with air pollution?
Yes, absolutely. So when people think about the economic benefits, they most often think about the benefits to government and the National Health Service, so not having to treat people who got sick because of air pollution or the other climate change effects. But there are quite a few economic benefits to businesses as well of reduced pollution. One major one is increased productivity. So if people aren't getting sick because of air pollution, then they're at work for more time. They don't have to retire early necessarily because of the health effects, and they can stay and work for longer. And the Confederation of British Industry calculated that for the UK, meeting the World Health Organization guideline limits for air quality would save the UK, save UK businesses 1.6 billion every year, and bring in an extra 3 million working days. There was a similar piece of work done in India by a consultancy firm called Dalberg, who calculated that for India, it would the benefit would amount to about 3% of GDP, or 95 billion every single year. So it's really huge, this benefit of getting people into work for longer. Those calculations don't even include the cognitive benefits. You know, if we're breathing pollution, especially in very heavily polluted areas, people just can't concentrate. And there's been a few academic studies done, mostly in kind of manufacturing environments, about people's productivity and output, just even on a single day when they're having to breathe high levels of air pollution indoors, and how it reduces their concentration and means that even if they are in work, they're not able to be as productive.
Mm-hmm. And I think that's really interesting, isn't it? Because sometimes there is a bit of a narrative which is, you know, dealing with climate change right now, it's an investment too far, we can't access all of the billions that might be needed. But actually the short-term benefits of just reducing the GHG emissions, improving air quality, are really there to be had. So I think those stats that you've just shared are one of the ways that we might deal with this reticence of, you know, it's too expensive, we can't allocate that capital right now. Thank you for that. We had another question that came through on the chat, and I'm going to go to Terry, if I may, which was a question asking for advice on companies if you want to engage your suppliers on environmental issues. So Terry, organisations out there wanting to engage suppliers on environmental issues, your top tips.
Well, I mean, it also starts with understanding where you can get the most benefit. So doing some analysis that allows you to understand which of your materials, which of your suppliers has an outsized carbon footprint for their particular ingredients. And then you have the power to decide, do I need that ingredient or that source, or can I switch to something that will have a fundamentally different carbon footprint, or can I work with the supplier? There's many suppliers who want to improve their footprint. They maybe don't have the technical resources or the bandwidth to deal with it and are happy to collaborate when you can bring tools and expertise. And then there's maybe going to be a subset where we really need just the floor to get raised through policy and other activities where you may be a minor, customer to that supplier, may not influence them, but if enough people work together, or if the policy begins to support it, we can get those as well. But this is a great space also for collaboration. Things like the Consumer Goods Forum, where we have common suppliers and we work together to drive for the improvements.
Great. Thank you. And you mentioned policy there. So obviously, as a business, you need to improve your supply chain, come with you on this journey. And going back to that issue of policy, that really essential need for the enabling context to allow business to deliver in this space. For you, Jane, makings understanding the, and what would you like to see?
Yeah, I think policy are understanding the connection, especially local authority leaders and mayors who are a lot closer to the general public. They really see a connection between things like air pollution, health, and climate change. And we can see evidence of that because they're citing the health benefits of climate action as they're rolling out new policies. National politicians possibly less so. I think that it's what I would love to see at the COP is for policymakers to connect the two agendas more closely, because there's a situation where we could have win-wins, where we prioritize things that are great for both climate and health, pollution reduction and greenhouse gas reducing activities. Or there's a kind of parallel track where we do things that are only good for climate change and maybe increase pollution, that I think would have the potential to really disengage people. So that's my hope for the COP, that the health and climate agendas are much more closely knitted together.
Great. And in our last remaining 3 to 4 minutes, I'd like to ask the same question of the three of you, if I may. You're dreaming big. COP26 has been an enormous success. What does that look like to you? And if I go to Paula and Terry and then to Richard, please.
Thanks, Sally. I think the dream outcome really is a very clear case made for the urgency that healthcare provides to the climate crisis and the action that's needed. And then we have the appropriate commitments and the appropriate requirements that come out of that.
Great. Terry?
Yeah, I'll just build, I think, if we get that urgency that Paula just described, that we really get those coalitions and collaborations across industries to just get the systemic change that's needed for all of us to be able to get to where we want to get to more quickly.
Great, thank you. And Richard?
I think it's that the countries of the world come together and they agree, but more importantly, that the richer companies agree to help the poorer countries, because I think that we have to look at this as a worldwide issue, and clearly the poorer countries of the world have got a whole raft of different agendas, and they need some help and encouragement. And we in the developed world should be the ones that are holding out a hand to them. Yeah,
and that's the deep essence of multilateralism, isn't it? And why we need multilateralism and strong democracy to get us to where we need to be. I'm going to chuck in my answer, which is I hope that every private sector participant in COP26 will read our report, download it from our website, and that for any of those in public policy, read the section on recommendations to government, because I think if the private sector players and governments read a bit of our report and took on board a few of those recommendations, and I think would be a lot closer to making every dollar invested, every pound invested, every action that we take around net zero to drive multiple benefits in multiple systems. So that's my dream. I hope everybody reads it. And I hope you all on the call read it as well. It's a contribution to accelerating change. It's not perfect, but I really do hope that it helps you all develop those integrated climate and health strategies. So with a minute to go, I would just like to say thank you again to our panelists. Thank you, Jane, for joining us for this part of the discussion. It's been great to have you. And thank you all for listening and participating. And I think we're going to go to a network break now. Have a good rest of day, everybody. Thank you.